Namaskar. Welcome to Ahara Arogya Adhyatma, the light of Samskara. Today we have Dr. Rajalakshmi R, who is a famous gynecologist, obstetrician. She was the past president of IMA of Udupi, and she has written a book almost like a guide to the women, and that is called as there she'll show it, Vatsalada Osage. That means, a woman requires more kindness and more concern, especially what she goes through during the periods and the delivery and all those things. And that's what she has written. And welcome, Raj Lakshmi.
Thank you, ma'am.
We know very well that women are a little different from men, especially for the pregnancy and then, this monthly periods. And monthly periods, those hormones, they give protection to her. So it is like a blessing for her. But many a times during the periods, the women get lots of moods fluctuation, lots of pain, especially the lower abdomen and the low backache. They are very, very severe and they start feeling very bad and they start cursing themselves for the periods. So please tell us, what is this dysmenorrhea? What are the causes for it? Please.
Okay. Namaste. Thank you, ma'am, for the opportunity. See, dysmenorrhea is the pain which is experienced by a lady during her menstrual cycle. So, first of all, I would like to say that it is a normal physical symptom which is seen of the periods. Usually, they'll have lower abdominal pain associated with low back pain and cramps in the legs and all. The painful menstruation only on the first day, the first 6 to 12 hours of a day, indicates that she has ovulated during the cycle. So that has been a ovulatory cycle. So that is a physiological symptom. So, but some people experience it more. So that time it becomes pathological.
Okay.
If they have only just prior to periods, 5 to 6 hours, then once the bleeding starts, if the pain comes down, that is a normal period pain what they are having. So it indicates that her menstrual cycles are normal and she'll be able to conceive easily.
Okay. But what is the difference between this physiological and pathological? Because some of them they have for a very severe and a longer period. So how to distinguish between the physiological and pathological and when they should come to you?
Okay,
and
yes,
what are the causes?
See, causes, yeah. Physiological pain is the normal pain, the pain which they experience for maximum, may you say, 24 hours, 6 hours before the period starts and the first day of periods. Okay. Secondary pain, secondary dysmenorrhea or pathological dysmenorrhea means it is not due to the normal ovulatory pain. It may be due to some infection, due to some pelvic inflammation, due to some tumors in the uterus like fibroid, or maybe some adenomyosis or endometriosis, some cysts in the ovary. So in that cases, the severity will be more. They will, if you scale the we grade our pain in a scale, the normal will be 3 to 4. In these people, it might go up to 10 also. The severity will be more and they'll have for a long duration.
Longer time.
Yeah, pain will start even 1 week prior to the periods and it will continue all 5 to 6 days of the periods. So that is how they can differentiate. And if in case it is due to endometriosis, they might have painful defecation while passing motion also. Stools also, they'll have pain. They'll have painful micturition. All those symptoms will be there.
So
along
passing the urine also will be painful.
It'll be painful. Sometimes they do, even if they have hematuria, the blood might get, the urine might get blood tinged. Yes.
I see. So
In
that
case
case,
severe
they must come to the
endometriosis,
doctor.
that time they have to come to the doctor.
Okay. Now, because many a times, the youngsters, those who are studying or working, they try to swallow the tablet and get relief from the pain, and they don't come to the doctors. So, what is your advice to them?
No, if the pain is little bit only on the first day, okay, 1 cycle, 2 cycle, they can take a tablet. They can
Hmm.
ask their parents or somebody and take. But if the pain continues, it is better
Hmm.
they visit a gynecologist, and
Hmm.
gynecologist examines them, does a
Hmm.
blood test, does a ultrasound, and diagnoses whether it is a primary dysmenorrhea, that is the physiological dysmenorrhea, or secondary or the pathological dysmenorrhea. It
Hmm.
is better to visit a doctor instead of taking the tablets continuously. That is, taking the tablets, pain relief tablets continuously can cause gastritis. It can cause
Hmm.
some renal symptoms,
Yeah,
renal damage.
kidney
So it is
problems can
better.
occur. Yeah.
Kidney, yeah.
Okay.
So
Hmm.
it's better to avoid taking the OTC painkillers.
Okay, okay, okay.
Mm.
So they shouldn't become doctors themselves. They must come to the
Yes.
gynecologist and take
Yes.
the opinion. And that too,
Yes.
if they have got a painful urination and the blood is coming, then getting the urine examination and motion examination, everything is very
Yes.
important,
They
you
have to
said.
rule out infections also.
Yeah,
Yes.
yeah.
They have to come
So
to us.
now, what are the investigations and how do you treat? What are the treatment modalities available now?
Okay. First is the basic lifestyle changes which will help. When they come to us, we do a random, the full blood counts to see whether they have
Mm,
anemia, then a
mm,
ultrasound to see whether they have any fibroid or endometriosis. Based
mm,
on that, their treatment will go. The basic
mm,
things they have to do is correct their anemia, have a healthy
mm,
diet, include
mm,
fiber, green leafy vegetables, omega
mm,
fatty
mm,
acids in their diet, and
mm,
they can have this almonds, chia
mm.
seeds, they can have
Okay,
banana, they can
okay.
have sweet potato, they can
Mm,
have food rich in magnesium, which will elevate their mood also. That is one
mm,
thing. And they have to avoid processed things, excess sweet, salt, and oily products, and also
mm.
caffeine and nicotine. This is the thing.
Okay,
Second thing
okay.
will be exercise. Exercise
Mm,
before periods also, during periods also, especially if some of the core strengthening exercises, some yogasanas like balasana,
mm.
baddhakonasana, supta baddhakonasana, cat cow stretch,
Okay,
stretching the whole body itself, along with
okay.
some deep breathing exercises will help them. So third
Like
step comes,
pranayama,
yeah,
like
pranayama.
pranayama. Mm,
Pranayama. Yes, that
mm,
will help them. Then they
mm,
can apply some heat. They can use the
mm,
hot water bottle or the hot water bags to give
mm,
heat to the abdomen or their lower back
mm,
to relieve the
mm.
pain. If that
Okay.
doesn't come down, then we prescribe them medications. If it is
Mm,
a primary dysmenorrhea with medication only, they'll be fine. Along with some
mm,
supplements. Usually we give some supplements like omega fatty acids, this
mm,
evening primrose oil and all. That also
mm,
helps to elevate the pain. But if it
mm,
is pathological pain, if it is due to some fibroid or some infection or some
mm,
endometriosis, then we
mm.
need to do the specific therapy for all the condition which have been diagnosed. If it is a
Okay.
huge cyst, endometriosis and all, she might even need a surgery.
Okay. Surgery
Along
means
with
you
that,
do the dilatation and curettage, or what is it? What sort of
no, we
surgery?
don't do a dilatation and curettage
Mm.
for the pain. That
No,
used
not
to be
pain.
done long
No,
back
no. If
because
there
they
is a
used to say
endometriosis.
endometriosis varies, ma'am. It depends where that endometriotic deposits are there,
Mm,
depending
mm,
on the site.
mm.
So, if there is a huge cyst in the ovary, we can do a cystectomy. Like that, we can
Okay.
do. Otherwise, we
Okay.
have to do diathermy, fulgration, seeing where the spots, and that we will be doing. And
Okay.
dilatation and curettage, good question you asked. Long time when I was studying, it was being done
Yes.
because
No, that's what
see,
I
one
have studied, 50 years back.
yeah, because that is the theory what grandma say, no, once you deliver, your pain comes down. That's because when you have a normal delivery, the cervix dilates and some of
Mm,
the nerve fibers get damaged. They may not regenerate. So,
mm,
through that narrow passage, when the blood passes, the pain will come down. Based
mm,
on that, previously they used to do DNCs and also
mm.
maybe to
Now,
diagnose tuberculosis. That time, all the
mm,
other newer blood tests were not available.
not
So
there.
to diagnose tuberculosis, they used to do DNCs. Nowadays, we
Mm.
don't do that. It is
Okay,
no more done.
okay, okay.
Yeah.
Apart from the medicines and then this surgery, any other alternative treatments are there available now?
Alternative therapy is
Like
mainly the mental health. Mental
mm,
health has to be managed. So she needs some
counseling.
counseling. counseling will be needed to her, because she needs to stay strong. Some people go to depression thinking that we can't go to class, my life is ruined, all that is what they
They
think.
can't do the work,
So
yeah,
they need
concentrate,
some,
yeah.
yeah,
Mm.
they won't be able to concentrate and all. So they need to be given some positive psychotherapy needs to be done. And then
Okay.
in pain clinics, they do give this acupressure treatment which reduces the pain.
Pain. Okay.
Yeah.
Okay.
So it
So,
should be I feel it should be a holistic approach. They should
yes.
be given the medical treatment also. They should be managed emotionally,
Mm.
psychologically, as well as the other therapies can be given.
Yeah. And along with that, the regular exercises also play a major role. And the diet is also very important. Instead of taking the junk food, if they take lots of fibers, so their constipation, pain during defecation, everything will come down. So it is a
Yes,
holistic approach is very important, you are saying. So
yes.
it is so very nice that you have explained about it. Anything else you would like to give as a
I
final
would,
thing? Yeah.
yeah, I would like to talk about exercise, ma'am, because
Okay.
period means pain, pain means rest. That's what everybody thinks. But
Okay.
little bit of daily activity, even mild
Mm,
walking, that will
mm,
increase the serotonin as us. So the mood
mm,
will be elevated. Plus the
mm,
blood supply to the organs all will be increased. The P
mm,
substance will be washed away and their
mm.
pain will come down. So exercise
Oh,
should be routine. That
okay.
thought that only people who are overweight need to exercise to lose weight, that is the common thought. That
No.
should be removed, and it should be a lifestyle. Then it will be easier to
Yeah.
conquer this pain also, ma'am.
So every woman should become mentally, physically strong. So she
Yeah,
has to do the yoga, dhyana, meditation, and along with that, the pranayama and also the regular exercise with a good, nutritious food. And that is the
yeah,
best way to handle rather than just taking the medicine and then,
medicines.
getting the gastritis and suffering with the uh, uh,
Yeah.
side effects of
And
that. Yeah.
yeah, and timely visit to the doctor.
Yes.
Timely visit to a gynecologist to see whether her pain is a physiological pain or she has any other issues with her genital system.
Yeah, that is very,
So
very
that is also
important,
of
that's very
paramount
important. Yeah,
importance.
important.
Importance,
Yes.
yeah.
Yeah.
Otherwise, they just do the home remedies and keep on waiting, thinking that even the elders at home, they will say, I only said first that the pain is normal. So they
Mm,
also will say, we have borne the pain, you also bear the pain. That should
mm,
not be the attitude. When she continues to struggle month after month, it should be a point to go and visit a doctor and see whether she has any comorbidities along with the regular
yes.
cycles.
Yes.
That should be the attitude.
Thank you so much,
Okay.
Dr. Rajalakshmi. You have so beautifully, in such a simple way, you have described what dysmenorrhea is, what is a physiological pain during the menstruation, and what is the dysmenorrhea due to the pathology. And then there are so many options and the treatment modalities. And then people, instead of suffering silently, they must come and get it treated in time. So thank you very much for your beautiful presentation. Thank you.
Thank you, ma'am. Thank you so much.